So this is a cell membrane, and glucose can enter the cell membrane and can escape from it. Normally, the glucose inside and outside the cell should be of the same concentration. Now here is a receptor which is called as the insulin receptor. And when insulin comes and affects this insulin receptor, this receptor gets detached from the cell membrane, activates an enzyme which is called as hexokinase, which attaches a phosphate bond to the 6th position in the glucose. Now this glucose cannot go out, and this glucose will undergo a process which is called as glycolysis and get converted into pyruvic acid. The pyruvic acid will make 38 ATPs going through the Krebs cycle and by the electron transfer or proton pump, and that will convert the glucose into CO2 and H2O. So this is the normal cycle of glucose. But supposing we burden the cell too much with glucose, supposing there's too much of glucose, lot of carbohydrate, then the cell learns to say no to this input. And what it does is that normally this insulin receptor would go and reform, attach on the cell surface, and therefore cell stops this process. So now the insulin receptors at the cell surface, they decrease in number, and you need higher amounts of insulin to produce the same results. This is called as hyperinsulinemia or insulin resistance. So the result is that glucose cannot be used by the cell, therefore the glucose increases in the blood. This is called as hyperglycemia. Then it goes and is secreted in the urine, that is called as glycosuria. And with this glycosuria, there is also loss of water. So since glucose is not available, therefore there is polyphagia, because the cell is hungry. Since water is being lost, therefore there is polydipsia and polyuria. So these are the initial symptoms of hyperglycemia, because glucose is more in blood and is being lost in the urine. Now the next thing that happens is that this pyruvic acid will get converted into lactic acid, which accumulates in the muscles and can cause fatigue. The next thing that happens is that there is a substance here which is called as acetoacetic acid, and this is one of the triglycerides. Other ones are 11-hydroxybutyric acid and acetone. If you are getting acetone in urine in diabetes, you know that the fat is burning. So triglycerides would come from fat. And which will make this change? Liver. So there is fatty liver and thus cirrhosis. And where would the fat come from in the liver? From fat stores. Therefore, there will be loss of weight, and this will travel in blood vessels. Therefore, there will be atherosclerosis, and this atherosclerosis will affect the renal, retinal, cardiac, and cerebral system. Therefore, according to this pathogenesis, if there is a patient of diabetes, you should look for the entire pathogenesis in making a diagnosis. So this type of diabetes is type 2 diabetes because there is hyperinsulinemia. However, if insulin production is damaged because of injury to pancreas, then there is type 1 diabetes. So this is about diabetes.